moving on to a very, very unusual topic that I saw, and the reason I kind of did this topic is I saw a story about a person. I'm going to tell the story about this girl named Jewel Shuping. Have you guys ever heard of her name? I never heard of her.
Her name's Jewel Shuping.
Shuping. Shuping.
Okay.
I've not.
I'd never heard of her.
No, I've never heard of it.
I saw a story about this girl. There was a news article, and this didn't just happen. It's been a little bit. So this girl was born completely healthy, but ever since she was a very little girl, she dreamed of being blind. She wanted to be blind. When she was a teenager, she would walk with a white cane, and by the time she was 20, she became fluent in Braille. You know, the blind language. And then at 21, she found a psychologist who agreed to help her blind herself. And she poured Drano into her eyes and then waited to go to the hospital as long as she could. And it blinded her. She went permanently blind.
She found a psychologist?
Allegedly. This is allegedly. She says, I looked it up and it says she never named who helped her.
Well, her psychologist needs to go see a psychologist.
Yeah, I feel like that person needs to probably face some prison time myself, but I digress on that.
That is horrible.
So she did go blind, and her family disowned her. They want nothing more to do with her. But she says that she now is so very happy because she feels like this is the way that she was supposed to be born, and she wasn't, and now she's blind. So what she has is actually a disorder known as body integrity identity disorder.
Okay.
And it is extremely rare. That's actually her. That's Jewel Shuping right there. After she blinded herself and she got her cane. So this is a very, very rare disorder. It's hard to quantify exactly how many people have this because it is so rare, but it's definitely way less than 0.1%. I mean, we're talking like 1 in tens or hundreds of thousands. And it is characterized by when an able-bodied person, so just normal, healthy person, has an overwhelming desire to be disabled. And that could be in the form of blindness like her, be an amputee, like lose an arm or leg, or be paralyzed.
Like,
and
I feel like that's like, I remember when I was a kid, my dad had a pair of what are those things where you put them under your armpits?
Crutches?
Crutches. And I used to be like, oh, I want to go play on those.
I don't
That'd
think
be
that
cool
qualifies.
to use them. I know, but no, I don't think I ever had that disorder. But I could see how if you started,
down
if you
the wrong
had
path.
that encouragement to do yeah, you should play on crutches.
Maybe.
Maybe her family was encouraging. You're a kid with an imagination and
Have you guys ever heard of this though? This body integrity identity disorder?
No.
Had you heard of it, Charles?
No, I haven't. I've not heard of it.
I have to say, I went through medical school and residency training, and I had never heard of this. I didn't know this was a real thing. And to be fair, maybe it's only being recognized as a real thing recently. But I don't remember learning about this in med school or residency. I can't say I've ever seen a patient that has it. So, I mean, this is not a common thing. I read this article, and I'd seen that, where I'd seen this term thrown around is when people are talking about people with gender dysphoria that want to have transition. And some people would say, oh, well, it's similar to body integrity identity. I had to go look it up.
I mean, that's what I thought about.
Yeah, I had to.
Except they're not trying to disable themselves.
Right, yeah. We can talk about that in a second. But yeah, I had to go look it up. I was like, wait, body integrity what? And then I was like, oh, that's a thing?
I don't know. That just seems so weird. Why would you want to impede your life to live?
I mean, it's a great question. The most common thing that people, it is much more common in men. I don't know if I mentioned that. 80% are men, 20% women. So Jewel was kind of in the minority there. The most common thing that people want is an amputation, they want to lose a limb, like an arm or a leg. Second is they want to be paralyzed, which that just blows my mind. Anyone would, I guess all of it blows my mind that somebody would want to purposely cut off their own arm. But the fact that somebody would want to be paralyzed, that seems like literally the worst thing in the world. I think I would rather be dead than be paralyzed personally. I don't know how you guys feel.
That's the reverse of being I wish I had superpowers.
I know, right? Yes, you're so right. It's there's people that want to be superheroes and people that I guess want the opposite, less
yeah, that
power.
is so strange.
Yeah, it's hard to wrap your head around. So of the people who have this disorder, almost 90% have thought about doing their own body modification. So a lot of
I wonder if they have they're more suicidal. because they're putting themselves, their lives at
That
risk.
that is a good question. I want to say when I looked this up, I do think that there was a higher risk of things of other anxiety or suicidal type disorders. I think
Like
you're
if
correct
they're
on that.
willing to go that far, what else?
Yeah, right, exactly. So of the patients that have this, 1/3 of them will go to a doctor to try and get the doctor to do whatever it is they want, whether it be amputate something, paralysis or whatever. I can only imagine, I would assume my office people would just block that. I would never hear about it because my office people are like, no, he's not doing that, click. I've never had anybody personally ask me to do anything like that. Another 1/3 actually attempt the modification themselves. So a third of
Yeah,
people.
because most doctors are sane.
Yeah,
would
they're
not do
not
that.
going to do it. No doctor's going to do that. So yeah, 1/3 of the people actually attempt to do it themselves, like Jewel, did to blind herself. As we said, the people that have it do sometimes compare themselves to patients who are trans that want gender transition. I don't know. I don't really buy that. And you hit the nail on the head. I mean,
It's like it might go down the same path, but it diverts.
yeah, it's a huge difference.
Yeah,
because,
it's like you might walk down. It has the same I want to be different,
right.
but I don't want to make it to where I can't live my life.
Exactly. I mean,
They're
that's
not doing that.
Because I
trans
don't think
people.
anyone would agree that someone who has gender transition is disabled. They're just
No, they just want to
regular
be
able
different.
people that are a different gender
Yeah.
after surgery. So to me, it's not the same. So of course, there's this big talk about ethics when you're talking about, and I'm not sure who's actually talking about this because I said I didn't even know this thing really existed. But when you read about it, there's people. Oh, there's this discussion about the X. Like, who's discussing this? But
Who's having
the
conversations?
discussion about it is by the ethics of body autonomy, right?
Yeah.
A person wants to do something to their body, and should they have the right to do that?
But isn't it against the law to commit suicide?
Is it? I
Like
don't
you
know.
could- like
I
if
think
you,
it
like,
depends on the
attempt-
state.
I don't know.
That's a big question you just asked. I'm not sure. I
I'm
have
pretty sure it is. That's why you can be arrested for
attempted suicide.
Yeah, for
Wouldn't
if
they
you
just
called,
put you in a kind of a mental hold? Or
Yeah,
something?
they do that. But I'm saying
I
they
don't
can
think they charge you with a crime though, do they?
I don't know. But if you tell a bunch of people one day I'm gonna commit suicide,
Oh, yeah, they're gonna commit
and
you.
and then
Yeah.
somebody's like, hey, this dude's
This
being
person
cray.
needs help. So with
Yeah.
body autonomy, I mean, when you bring up the question of that in a person with body integrity identity disorder, the medical consensus is that they don't have the insight to the disease that they have, so therefore they lack the autonomy to make the decision.
Yeah.
And I guess that's just the doctor way of saying we're not going to do this,
Well, it goes against like I said, your
do no
ability to
harm.
live.
Yeah, I mean, I guess the whole doctor mantra is do no harm, right?
Well, I mean, yeah, but it goes against a human nature
Right,
instinct.
to disable someone. I mean, and honestly, I have huge ethics issues with making someone disabled so that they're dependent on other people.
Yeah,
or
but maybe
dependent
that's
on
what
the
they
government.
want.
I mean, that is a good point. I don't know. That seems like a very big step.
They want people to
Support
have to
them.
care about them,
Yeah.
not have to care, but have to take care of them.
Well, currently the recommendation is not to indulge in their desire for body modification. There is therapy for this. Cognitive behavioral therapy is apparently pretty effective in treating people with body integrity identity disorder. And then also the SSRIs like Zoloft and Prozac have been shown to be helpful. So
Well, that's good. That's scary.
it's crazy stuff. I honestly, until the past year, I didn't know this was a thing. I don't know. I'm not sure I believe the statistics to say 1 out of 1,000. I think it's like 1 out of 1,000,000 maybe. I've never seen anyone or heard anyone in my 20 years of doing medicine that has this.
Yeah,
So I don't know.
intense.
Crazy.